Good afternoon, ladies and gentlemen. Today we'll talk about the median nerve palsy, which is really important nowadays. There is a lot of issues for people like having carpal tunnel syndrome. And from the word median nerve palsy, anybody know where it's located and where it runs? Yes, sir.
And I'm roughly down the centre of the arm and forearm. I'm doing your gestures.
Yeah, exactly. We'll talk about the anatomy, which is the median nerve palsy. This is the nerve roots, and when the roots come with a cord, see this is the nerve, the median nerve, which runs along the arm and forearm. And as you notice, there is no branches here in the forearm, just in the forearm, not in the arm, to supply the hand, as you can see in this picture with the red lines, and you can notice in your hands where the median nerve supplies the area. So any issues would be affected those areas. Moving to factors, which is occupational and non-occupational factors. The occupational factors, as you know, people working in the computers, they do a lot of repetitive movement. They can experience the median nerve palsy, which is compression at the median nerve, at the hand level. And there is non-occupational factors, which is previous family history, or pregnant women, diabetic patients, because they tend to have the neuropathy, which is the disease affect their the nerve endings. Patient will come to the clinic with the pain, numbness, and muscle weakness, and the physician tend to do like some examination. One of them is called bench grip, which is, you can see the picture here. Patient cannot grip like items because of the nerves get affected in the area of the hand. And also he cannot do repetitive movements. If the physician asks the patient to do like any repetitive movement, he can't do it. As in severe cases, some patients wake up at night and pain lasting for hours, and combined with the numbness. Loss of sensation. As I said, the median nerve will supply the sensation to the hand, so the patient tends to lose the sensation in the hand, and sometimes deformity of the hand. So you see in this picture, when the patient cannot do this because the median nerve will supply those fingers, so he has no control of those fingers. Moving after the clinical presentation, the physician will diagnose the case. He will take medical history and some examination. Fallon test. Anybody knows what is Fallon test? Yes?
You make some fabric from the nerve and see the thick or very small.
Actually, I think what you're talking about is the tunnel test. Yeah, the funnel test, basically the patient will bring the arm 90 degrees, the hand 90 degrees. After a while, he will experience tingling in the hand. And the tunnel test, as Rania said, the doctor will tap along the area where the median nerve runs, so the patient will experience tingling and pain. And if the patient gets positive at those two tests, then the physician will tend to do X-ray. Maybe there is bony structure compress the nerve, or we can do the EMG, which is the nerve conducting studies, and MRI to visualize the nerve, where exactly, which level the nerve it's being compressed. The treatment is dependent on the severity of the case. If it is like mild, soft massage and use of the splint to fix to like prevent the patient to do the movement. And if it is moderate, corticosteroid, which is analgesic drug, with a splint or for full time. And in severe cases, which is the last choice, doctor will go for the surgical intervention. And it will be avoided for the pregnant, because the pregnant woman, she got the disease when she was during the first or second trimester. After she delivered, the disease may go. There is 3 complications, major complications. If it is not treated, the muscles where the nerve supply will get weakness, and the corticosteroid have a side effect. So excessive amount of corticosteroid, patient may experience anxiety, depression, hypertension, eye cataract, sexual dysfunction. And after the surgery, which is in severe cases, may have infections, nerve injury or nerve scar because of the surgery. Prevention always is better than cure. And as you prevent, you have to educate people about this disease, using the splint to prevent the movements. Do not rest alarm most of the time. Like if you're typing or using the mouse, you have to take a break and exercise your hand a little bit. Early investigation always is better than like patient come with a severe case. Physiotherapy and deep massage and warm-up stretching exercise would be easily and is most benefit for the most of the patient in the early stages. In conclusion, if we understand the anatomy and know the risk factors that lead to the palsy, and as I said, the clinical presentation like pain, loss of sensation, and hand deformity will be avoided in the early stages. Failure of conservative, it means conservative treatment, as I said, massage and corticosteroid is indicated the last choice, which is the surgery. This is some reference. You can go through the website and read about the disease to get more educated. Thank you for listening. If you have any question, otherwise I will ask you questions.
When you say a warm-up exercise for, computers, what would you do?
You can just move your hand around a little bit.
This is before you get on the computer?
Actually, in between.
In between.
Like if you work like half an hour, then go do some exercise and come back to work, rather than like working for an hour or 3 hours continuously. If it's good for your back to do some exercise, so the blood and circulation will go in good manner. Any questions?
Thank you very much.
Okay.
It's here, it's in the can. We have it. Ready for broadcasting.